Hello, everyone. This is Gary Dean, Secretary of the Indiana EMS Association, and this is the Legislative Breakfast Briefing. All right, so the breakfast is on Thursday morning, February 9th, 2017. Opens at 7:30 a.m. The State House does, as well as the start of our breakfast. Goes on until about 9:30. We're going to be in the North Atrium area. That's just off the parking lot to the north. That borders Ohio, and this will be a great opportunity for us to contact legislators once they are in the building. And you will be going through security with a metal detector, so reminder to please leave any weapons in your vehicles. RSVP, hopefully everyone got a chance to RSVP for the legislative breakfast. This helps us get some name tags, and also helps us identify your legislators to help you contact them and connect with them. The legislative committee that's helping put everything together, myself, Kim Godden, who's helped a lot with some of the reimbursement issues, Gary Miller, Nathaniel Metz, Becky Blagrave is helping a lot with the EMS Memorial, Farrell Ward, and George Schulp. If you're unsure of a question from a legislator or a staff member, don't try to make it up. Direct them to one of the above personnel or someone on the board, and we'll try to get their information and get back with them to give them accurate information. So who is your legislator? If you can do this ahead of time, that would be great. You can go on the Indiana General Assembly website and look for the Find Your Legislator and insert your name or your address for both your personal location as well as your organization, because they may have different legislators, just so that you can connect with your constituent, because legislators respond very differently when they know that they're talking to someone that's in their area. All right, so basic house, the schoolhouse rocks kind of thing going on here about how a bill becomes a law in Indiana. Just wanted to make sure everyone kind of is a little bit more familiar with the process. 2017 is a, quote, long session year, and this means legislators are working through the end of April on legislation. On the even-numbered years, these are the short session, which is about a month and a half less amount of time to work on things. This is designed to have the legislators do a lot of focus on the budget during these odd years. There's two legislative bodies, the Senate and House. State senators, 50, serve 4-year terms. State representatives, there's 100 of them currently, and they serve 2-year terms. And legislators are limited to the number of bills that they may introduce, and there's a strict deadline in submitting. There are a lot of deadlines. Here's just some of the deadlines currently within the Indiana legislature. The one coming up is the last day for third reading of House bills and Senate bills on February 27th and 28th. By now, everything should have been assigned to a committee. If not, then they will likely be dead. All right, so once a bill is presented, it's sent to a committee by the House. That committee chairperson has a lot of power. That's when you hear about different committee chairs, not bringing a bill up for vote or whatever. So they have pretty much sole ability to call a bill up to be debated. And if it's not brought up, then it dies. So once it's put on the docket, the author will generally present the bill to the committee. Committee will ask questions, and then there will also be time for testimony from the public, from usually different associations like Indiana EMS Association, or the firefighters, or the nurses, etc. So the committee will hear this testimony, ask their questions, make amendments as needed, and they will decide to either keep it in the committee till a future date, where they can do some more follow-up, or it will be voted in the committee and either passed or not. If it is passed from the committee, it's presented again in front of the entire legislative body, and this time any additional amendments may be placed. It may be sent to a different committee if the chair so desires, or it could be it could be voted on and passed. So once it's totally passed from one house, there is a sponsor from the opposite house. And then that person brings it up and the whole process repeats. Now, if the bill was amended after switching houses, for example, if a House bill got sent through, then the Senate amended it in committee thinking that it needed to be addressed, then there's now two different versions that were approved by each house. So then a conference committee of people representing both get together and come up with a decided upon final version that will then get revoted on by both houses, and then, if passed, sent to the governor for his signature or veto. Now, some of the legislators of interest here, we have 10 currently that have been involved with EMS bills in the past or currently, or are on chairmen of or chairpersons of different committees of interest to EMS. Let's start with Representative Carly Macer from the west side of Indianapolis. She's been very familiar with Indiana EMS Association. She spoke at our conference last year in 2016. She's been the author of the EMS Death Benefit Expansion Law in 2015 and has served on the House Public Safety Committee. Representative Fry is the chair of that committee and also retired IFD EMT firefighter, and currently representing the Greensburg area. He hears a lot of EMS legislation in the House. The chairman of the chairperson of the House Public Health Committee is Cindy Kirchhoffer. She's from the Far East side of Indianapolis. She authored the Peer Review Protection EMS Audit Review Bill from last year that gives us some protection during those during those discussions. Her spouse personally is a paramedic firefighter, so she understands a little bit more than the average legislator the issues going on with EMS. Representative Forrestal has also been a co-sponsor on a number of EMS bills, has reached out before for input on bills prior to introduction, and currently IFD EMT firefighter as well. He represents the east side of Indianapolis. Representative Zent serves on both of those committees that we have talked about before, and is also chairman of local government committee. We've talked to him multiple times over the last few years at the Legislative Breakfast, and he's an author of a couple different bills that we're looking at, and should be a great asset for us. Senator Jim Merritt has been the author of a number of lifeline laws over the last few years, different protections for reporters of overdoses, alcohol and heroin mainly. Has had a lot to do with the expansion of Narcan use into EMS, EMR, and the general public the last couple of years and help address the opioid epidemic. Senator Ed Charbonneau replaces Senator Pat Miller after she retired as the chairman of the Senate Health and Provider Services Committee, and has been the author of the School Emergency Medicine Bill, which we have spoken favor of already. So this committee will hear a lot of our issues in the Senate. Representative Tim Brown, Dr. Tim Brown from Crawfordsville, is a physician and the chair of the House Ways and Means Committee. So he has control of the purse strings, so to speak, and deciding a lot of funding issues for different agencies. Also was the author of the state EMS medical director law in 2014. Has not had a lot of medicine or emergency medicine the last two sessions since he has been the chair of the Ways and Means, but definitely could be a very helpful person in the meantime. Senator Kreider is the chairman of the Senate House Homeland Security and Transportation Committee, which will hear some of our bills. And Representative Wesco is the author of the CISD bill, the Critical Incident Stress Debriefing bill, that has been pushed through pretty quickly and had a lot of good discussion. All right, so a little bit more about committees. This is where the bulk of the work is done for legislation. And the following four committees, the two House and two Senate, which we touched on a little bit, is where EMS bills often go. So we'll start with the Veterans Affairs and Public Safety Committee in the House. Representative Fry, again, is the chair, and Carly Macer is the ranking minority member. You see Dennis Zent and a couple others there that we've talked about as the other members of that committee. In the House Public Health Committee, again chaired by Cindy Kirchhoffer and Vice Chair Ronald Bacon. Ron Bacon has another couple bills that we're looking at currently. Dennis Zent there again. Representative Greg Porter is the Vice President of Eskenazi Health in Indianapolis and another public health advocate. Health and Provider Services in the Senate, chaired by Ed Charbonneau. And you see other majority members, ranking minority member, Senator Gene Breaux. All right, and finally, the Senate Homeland Security and Transportation Committees, chaired by Senator Kreider and Niskowski from the ranking minority member, has been helpful with some fire and EMS bills in the past. And you see there Jim Merritt and John Ford has also authored a couple of the bills we're looking at this year. So some of our current areas of focus, some of the things we'll be having handouts with that may help generate some discussion for you are as follows. So at its beginning, the EMS Association has always kind of really focused on reimbursement. We've talked about it the last couple of years, but really haven't hit it hard. So we're going to kind of hit it hard here with this handout. We have a little bit of updating to do on it, but this is basically looks at the Medicaid reimbursement rates for EMS and how they have really gone unchanged since the 1970s. You see the governor's salary increasing over 200%. The inflation rate, $1.76, buys you $4.20 worth of stuff in 2016. But yet all the Medicaid rates have pretty much gone unchanged. Some have even lost money, like, for example, the BLS non-emergency calls. So this just will hopefully show them where there's a lot of work to do. We'll be providing an update about community paramedicine, mobile integrated healthcare, discussing some of the challenges, opportunities available, some potential legislative agendas to like payment for non-transport activities. We'll also be pushing for a study of EMS provider shortages. There's actually currently legislation in the Senate Bill 538, that urges a study committee to look at healthcare shortages overall, with kind of specifically looking at nursing. Does not include EMS currently within that bill, but could be an area that we could help advance during the legislative breakfast in talking with that bill's authors and the chairperson of that committee. We'll also be providing a short update on the memorial, kind of talk about some of the funding mechanisms that we have for that, the license plate being our primary funder, challenge coins, and other different fundraisers from other organizations that's going on. Some other potential discussions and inserts we'll have one on some of the basic stats of EMS in Indiana, the different numbers and types of providers, approximate number of runs, the different numbers of services that are in Indiana, and the basic breakdown of nonprofit, for-profit, fire-based, hospital-based, municipal, etc. Also have a kind of an invite for legislators to talk with us, so we may help connect them to their local EMS agencies if they haven't made those contacts already. Kind of remind them that they could probably go on some ride-alongs and some other potential topics of conversation. And in the end, it's whatever you want to bring up. You know, we have some ideas here, but every single person has to help meet the needs of their service or their community. So bring some stories, talk about different issues that pertain to you, and share with your elected representative. So now we'll look at some current legislation. Going to switch screens here onto a spreadsheet and look at these. So currently, we'll start with House Bill 1542 and Senate Bill 392. These are companion bills. It means that they have relatively the same language and will help expedite things within the legislative process if it was brought up in both chambers simultaneously. This adds to the list of emergency medicines in schools. Currently, only EpiPens are allowed, and this adds makes it so that future medicines can be added easier, and adds albuterol and naloxone into lists of emergency medications. And this is, of course, after proper training and a review process. And this is a may provide provision, so it does not require schools provide this because there is no funding mechanism with it. But there were some different associations that spoke during the hearing that we also spoke at about providing low cost or free options to some of these medications like Narcan. Next one, House Bill 1145, stroke protocols for EMS. This sets up a summer study commission to look at improving the stroke system within Indiana. This has been a pretty hot topic within EMS, mostly positive, and we'll be looking at this very strongly. Representative Zent is the author. Next one was brought up by Jim Merritt a few months back after an incident involving a police officer getting an argument and ended up being shot at home. This basically makes the penalty the same for assaulting public safety officers on duty versus off if it was done because of their position. You want to think of an example for EMS potentially. We've had family members and patients stalking some of our providers after runs, and they may go and assault them at home because they didn't provide the service or whatever, and so that would be treated the same elevated level of a felony if it was done to an EMS provider versus just a regular citizen. The next one, House Bill 1424, is an interesting one. I've heard of this program going to different conferences and exhibit halls. It's the yellow dot program, basically. A person would put a yellow dot on their driver's side window, and this would signal to EMS providers and first responders that the person has some crucial medical information that is in the vehicle, usually like the glove box. And if that person is unresponsive and you need information on their medical care that may help in assessment or treatment, and that it will be in an envelope. So we're watching this one. It's currently in the Committee on Roads and Transportation, so not a common committee that we're looking at, but yeah. Next is Senate Bill 119, Air Ambulance Service Standards. It requests that the EMS Commission in assistance with state health develop some standards for activation use of medical service for patients from the emergency scene to a trauma center, and that it be updated. Emergency action plans for schools, House Bill 1288, requires schools work with EMS and others to have some type of emergency action plan. So this should help make those situations when you respond to schools a little bit better and another chance to work with the community. Statewide trauma care study, another summer study, Senate Bill 174. 1122 we talked about a little bit earlier. The critical incident stress management services. Basically, this provides some liability support for people who are providing CISD to public safety officials. And this has gone very quickly all the way through the House, all the committees and everything within the first week or two of the session. All right, and a couple others here. The Senate Bill 538, healthcare provider shortages. This urges Legislative Council to assign the topics to a study committee. Remember, this does not include EMS currently, but working on hopefully getting that amended. A couple other ones that may be interesting to some. 1185 gives some liability protection to providers if we care for animals, as long as we're not, negligence or willful misconduct. And that is about it for those bills. All right, currently we are using Legiscan software, our tracking site, to look at some of the different medications and everything. You can kind of look before here, you see the most recent action taken on the different bills that we're watching. And this also has the ability to show us when bills will be have been brought up for debate in committee, so we can provide testimony. And we also utilize a team of bill readers to evaluate each bill and its potential impact on EMS. We just kind of started this recently, last few weeks. We don't have a lot of bills read. We probably have about 11, as you see here. Basically, we send a link to the bill reader, and you'll see the different bills that we're potentially reviewing. They would choose that, kind of have an overall how it would impact that person and their agency, both negatively, positively, and just overall impact. And then looking at basically figuring out what level of support should IEMSA have for this bill. This is based off of the NAEMT levels of support. So basically, we utilized their legislative review process, and then just whatever suggestion that is and why. So this just helps us look at bills, because it can't just be one person or a group of 2 or 3. We try to get as much input as possible from all walks of life. We want fire-based, hospital-based, municipal, public, private, non-profit, just trying to get a good idea of how it affects the industry. And so we can really, truly be a voice for EMS in Indiana. So looking at the current climate, there's only 3 committee meetings scheduled right now for the morning of our breakfast. You can see that on the right, some early morning meetings. Last day for bills to be debated, February 27th, 28th. It's still a Republican supermajority in the House and Senate, as well as the governorship. This is unchanged from last 2 or 3 sessions, so that much has not changed. This year, there's not that many social issues being discussed. In the past, we've had RFRA and marriage equality and a couple other bills that have gotten a lot of attention that have kind of shied away some of the other bills that people are looking at. So this provides more opportunity for substantive bills to be discussed. One of the notable exceptions, the House Bill 1134, the so-called abortion bill that potentially can be the next Supreme Court challenge on Roe v. Wade. So that may pop up later on. Roads funding and House Bill 1002 and the constitutional carry for concealed weapons is another thing that can be on the horizon that you may hear discussed a bit at the State House. So next section here is a video from NAEMT on basically how to speak with legislators about EMS issues. This is obviously being from NAEMT, more of a federal legislation, but pretty much just take away talking to congressmen and senators with state representatives and state senators. So a lot of the same applicability, and at the end provides some nice overview of things to remember. So enjoy this, and get back with you in about 5 minutes.
Hi, I'm Jim Davis. I had the privilege of representing the Tampa Bay area in the United States House of Representatives for 10 years.
Hi, I'm Lisa Tofel, and I'm a partner here at Holland & Knight.
And I'm Rob Brandner. I'm also a partner here at Holland & Knight.
Members of Congress, both in the House of Representatives and in the United States Senate, want to hear from the people that they represent. Visiting your congressional office can be daunting if you're doing it for the first time. We want to help you understand what to expect when meeting with your elected officials, as well as some tips to make your advocacy as effective as possible. Hi, Congressman. My name is Lisa Toffel, and I'm an EMT, and I provide healthcare services in your district.
And do you live in the district?
I do, Congressman.
Oh, good.
I
Good.
do live in the district.
Good. Nice to meet you.
Nice to meet you.
You have a connection to the district. You want to make that initial connection with them.
Every member of Congress you meet with wants to know how the issues they are dealing with up here affects folks back home, and you're in a very key position to let them know that powerful connection.
There's so many problems right now that are plaguing emergency medical services. A specific example, Congressman, is that our ambulance agency can't afford what's called a 12-lead EKG. It enables us to spot a certain kind of heart attack, and if we can see that heart attack on the ambulance before we get to the hospital, then we can bypass the emergency department and we can take your constituent straight into the cath lab.
Tell your story. You have a personal experience. You're devoted to what you do. You want to convey that commitment to the person you're meeting with, and you want them to remember your story, because that's what's lasting. That's what they'll be thinking about when they start making decisions after you're gone.
Hi, I'm the Congressman's Chief of Staff.
Remember, the person who opens the door for you today may be the Chief of Staff tomorrow. These young people often really appreciate being treated with respect. They're eager, they're good listeners. When you're talking to a staff member, it's close to talking to a member of Congress. Most good staffers will report to the member of Congress what you said. They will often offer their own opinion. So remember, you're always trying to persuade the person who's in front of you. Sometimes you'll end up meeting with a member of Congress in a busy hallway with a lot of background noise and distraction. Just stay focused. Tell your story, get your point across, make sure they know you care so they'll care. What if we just limit your bill to gun accidents? Would it work?
Congressman, we treat so many patients with a variety of emergency medical conditions.
It is easy for them to get distracted. It is easy for them to be having a bad day. And so you do want to be to the point on your request with them and make sure they get it.
The purpose of the field EMS bill is really to help address some of the systemic problems that were identified by the Institute of Medicine.
What I've seen frequently is people who come in immediately and hand the paper to the person with whom they're meeting. I generally advise against that, because what you will frequently see is the person you're meeting with will then start reading the paper, at which point they are no longer listening to you. The most important thing in a congressional meeting is to make sure you make your ask.
We really are hopeful that you will co-sponsor H.R. 123, the field EMS legislation.
It may be to sign a letter. It may be to co-sponsor a bill. It may be to attend a briefing event. It may be to invite them to something in the district.
These members of Congress and their staff are extremely busy, and ultimately what they want to know is what can they do to help. And so at the end of a meeting, you always want to make sure it is very clear to them specifically what you're asking them to do.
We're hopeful that you'll take a hard look at that field EMS bill. And
the second thing around that, connected to the ask, is to get out of there with a follow-up step. How can I follow up with you on that? Can I call you next week to check in on it? Send you an email, some sort of mechanism by which they know you're going to come back again.
You want to be a squeaky wheel, but not a screeching wheel. But persistence is very important on Capitol Hill just because they are so busy. And it's very important when you do your follow-up communication to thank them for their time and their interest in whatever issue it is that you're bringing to them.
It is critical to these members of Congress to understand how decisions they're making in Washington are affecting the folks they represent at home. You're in a unique position to connect those dots with the member of Congress or their staff. Don't miss that opportunity.
So in summary, some key things to remember before you come to Capitol Hill. Remember to bring business cards. Bring any local information that tells your story. Wear professional clothing and wear comfortable shoes.
Turn that cell phone off before you come in. Be ready to be flexible with scheduling changes and location changes of all kinds. Be clear, be concise, expect to stay within 15 minutes on your message, and get your specific request out there, your ask. Talk from the heart. Talk from your experience. Don't forget to follow up with a thank you note, with an email, with some form of communication, and make sure that you have a mechanism by which they've agreed to let you follow up with them on your request.
Don't use industry jargon. Do help them understand your profession and the issue that you're raising. Don't get frustrated if it's not going well. You want to remain professional at all times. Do remain cognizant of the time and get your messages and requests across. Do remember to leave your card and materials with the people that you've met with. And do remember to follow up.
Everyone up there is very oriented around their constituency. If you're from your district, that means a lot to them.
Tell your story. You have a personal experience, you're devoted to what you do. You want to convey that commitment to the person you're meeting with, and you want them to remember your story, because that's what's lasting, that's what they'll be thinking about when they start making decisions after you're gone.
All right. I hope everyone enjoyed that. Again, those probably weren't the best actors, but hopefully that was very helpful. So again, to hit a couple points that they talked as well about, bring your business cards, dress in Class A or at least business professional suit and tie. Bring a story. Talk about your case, your agency, about your challenges. Know who your state representatives and senators are. Try not to get involved with too many unrelated controversial issues that may be out there. And follow up. Thank them, do a thank you letter, answer any questions that they had, invite legislators for a tour of your station or do a ride along, etc. And also try to get more involved with current legislation. Call your state senator or state representative about different bills. Join the state association or the national association and just get more involved in your profession. And in the end, everyone, have fun. And I wish you the best. And we will see you on Thursday morning, bright and early at 7:30 a.m.